This week is a week about results in the Senate. And, sometimes we get down on the Senate not producing results, but we're on the floor of the Senate right now with a massive bill, the Endless Frontiers bill, which is to try to scope out the dimensions of the US-China competition. There are many aspects of that bill that I already have in the bill. We hopefully will get to a final vote on it tomorrow. There's others that I'm trying to get in, but I can tell you that we'll get to a vote on this bill by the end of the week, and it will be a significant and extremely bipartisan victory in charting out the dimensions of what will be the most important strategic relationship, competition, confrontation, occasional cooperation in the world, probably for the rest of the century, the US-China relationship. In addition, in the Health, Education, Labor, Pension Committee, with the able leadership of Chair Patty Murray and Ranking Member Richard Burr, we yesterday passed a series of bills, two of which are very, very important to me, and I'll mention them. I've talked about at least one of them before, the Lorna Breen Healthcare Provider Protection Act, named in honor of Virginia native Lorna Breen, family in Charlottesville, an emergency room physician in New York who, after the ravages of the opening weeks and months of COVID, died by suicide tragically at the end of April last year. Working together with Republican and Democratic colleagues, we put legislation on the table named for her to invest funds and strategies to keep our healers healthy, to make sure we're doing everything we can to help our frontline healthcare workers access mental health services and to break down any stigma that services need to be available. And our healthcare workers need to know that they won't lose a license or lose privileges or credentials at a hospital if they seek mental health assistance. We were able to pass the Lorna Breen bill by unanimous vote in the Health Committee yesterday, and we're looking for prompt floor action on the bill. We also passed a set of bills dealing with maternal mortality, including a bill that Lisa Murkowski and I filed to focus on the need to make sure expecting moms are getting vaccinated. The issue of maternal mortality has bedeviled us in Virginia and nationally, and particularly among minority communities, African American, tribal communities, and others. And it's exciting to see the Health Committee moving forward with a set of initiatives to tackle this again in a very bipartisan way. And with that, again, I really appreciate your patience today as we were on the floor after this devastating news about John Warner's death, and I'm glad to open it up and take your questions.